Our presentation today is on angina. What is angina? Angina is a subternal chest pain, pressure, or discomfort that normally increases by external anxiety and emotional or mental stress. Angina is caused by coronary artery disease. It lasts for about 30 to 60 seconds. To prevent angina, nitroglycerin is used. This medication is used to relieve any angina attack that is occurring. Risk factors. Some risk factors of angina are age, family history, smoking, high blood pressure, high cholesterol, diabetes, obesity, physical inactivity, unhealthy diet, stress, or sleep apnea. Symptoms. The basic symptoms of angina are fatigue, weakness, palpitation, stress, dizziness, and sweating. Some symptoms women experience through angina are having delayed response to angina and seek more care than men. The symptoms are nausea, vomiting, lightheaded, short of breath, weakness, and sharp pain through the arm, chest, back, and abdominal. The pros and cons. Pros: warm up for at least 10 minutes and do proper cool down after the workout, which allows the heart rate and breathing to return to a regulated level. Motivation for lifestyle changes, as anyone that's diagnosed with angina could be motivated to adapt to a healthier lifestyle, including diet change, regular exercising, and reducing any further complications. Con: avoid doing any exercise if you feel any of the angina symptoms, or just stop immediately from the exercise. Once an individual has experienced angina before or any other symptoms, they could have fear and anxiety of having it again, and it could affect the person's mental well being. Benefits. The benefits are to improve cardiovascular fitness, increase muscular strength and endurance, and improve range of motion. Exercising helps with daily routine, gives more energy and motivation to the individual. It also helps with reduction of symptoms such as common ones, which are chest pain and short of breathness. Exercising with angina. Some low impact activities such as walking, cycling, or water activities, including swimming, which involves larger muscle groups. Start off with shorter sessions, about 10 to 15 minutes, and then slowly build up to 20 to 60-minute session. Do this 3 times or more per week. Light resistance circuit training, whole body range of motion exercises 2 to 3 times per week. Exercises to do: aerobic training, which is cycling, walking, or walking on a treadmill, and swimming. Here is an example of Bhavin doing cycling. The reason to do cycling is that it helps improve the cardiovascular fitness, such as the heart, lung, and improving overall cardiovascular health. Exercises to do: strengthening circuit training, squatting with weights, seated row machine or with resistant band, lunges with weights, and incline plank. Here are 2 examples of Bhavin doing the incline plank. The reason to do an incline plank is that it allows for more of a gradual increase in intensity compared to a regular plank that's done on the floor. The incline plank also provides a modified version of the exercise that may be more manageable for the individual to do depending on their fitness level. Here are examples of the seated row machine. The seated row machine provides a low impact workout and places less stress on the joints. It also is an advantage for individuals that avoid high impact activities due to cardiovascular health. Use resistant band is just a modified version of doing the seated row on a machine. It's the same low impact workout as used on the machine or with the resistant band. When getting a client to perform, advise them to adjust the seat according to height so that the handles are at the chest level or slightly below, and make sure the feet are flat on the footrest with the knees bent at a comfortable angle. Choose appropriate weight. Start off with lighter if the exercise is new to the individual. Do as many number of reps as you can. Avoid excessive momentum. Keep the movement controlled and avoid using momentum to pull the weight. This makes sure that the target muscles are doing the work. Lastly, immediately stop if you are feeling any of the angina symptoms. Here are the references, and thank you for listening.